In this video, we're going to be demonstrating exactly how to take a great PBS bite recording. Notice here that we have preparations done on either side of the patient's lower mandibular arch. We're going to add our PBS bite registration material to those areas that have been prepared so we don't lose exactly where the patient is biting together. So before the doctor will go ahead and prepare the front teeth, we're going to take a bite recording, and you can see here that the material has been extruded onto the occlusal surfaces of that patient, and the material is going to be allowed to set. And after it is set, we're going to remove those. We will try them back in to make sure that they fit properly and to also make sure that we see and can acknowledge exactly where the patient bit into the material and that they bit together the way that they should, and that we're seeing these interdigitated marks into our bite registration. Now, once we have basically gone through and looked at those and make sure they're correct, we're going to add some more bite registration material to the anterior areas and have the patient bite down into that lower component that we just made in addition to those back two bite registrations that we previously did. Now the material has been allowed to set, and we're going to just make sure that everything is looks correct. And then after those teeth were prepared, again, we're just going to go back and check ourselves. And the reason we like to do this in a couple of different segments is because, again, the posterior teeth were prepared, and now we want to take a bite recording before we just arbitrarily start preparing the anterior teeth. And then now that that's been prepared, we can basically combine the two and have a really good, accurate, full arch PBS bite registration.